This is about, of course, knowledge exchange. It's about two organisations that are passionate about raising awareness, both among health professionals, but also among policymakers, management in healthcare organisations, and the public about this condition, sepsis, about infection, and about the link between infection and antimicrobial resistance, and the fact that actually they're not opposite messages.
In terms of that, how important is it that organisations do collaborate to make the awareness, to make people aware of what's going on?
So our view at the UK Sepsis Trust on this is that collaboration is the only way forward. We're in challenging times economically. We won't find one organisation that has the resource to make the world aware of this issue. And the world needs to become aware of this issue, so collaborations are the only way forward. The reality is that if we don't address the urgent management of time-critical infection alongside infection prevention and antimicrobial resistance, then mankind is going to be in trouble, let alone any nation.
In terms of that, there's a lot of focus, and rightly so, on coronavirus at the moment. Obviously, there's got to be a link between sepsis and COVID-19.
Absolutely. So COVID-19, as many will know, is the disease caused by the SARS-CoV-2 coronavirus. And right now, it's the third week in March. It's sweeping across our nation, as it is many others, and it's frightening. The link between sepsis is becoming more clear. We know that patients who've survived sepsis within the last several years are more prone to developing infection and therefore sepsis, and it appears that they're more vulnerable to a serious reaction to COVID-19. So they're a vulnerable group and they should self-isolate. The second link is that where people are becoming critically ill with COVID-19, and particularly when they're dying, sepsis again rears its ugly head. Depending on which country's data you look at, anywhere between 30 and 50% of patients with COVID-19 in intensive care have either a secondary bacterial infection or they have sepsis with organ failure. So it's really relevant.
So how well prepared are the NHS as we face the prospect of unprecedented demand on the critical care system?
So the problem with this is, of course, that we don't know for certain. We don't know how big a problem this is going to be. We can look to other countries, we can model ourselves on other countries, but there's a lot we don't know about this. So right now, third week in March 2020, London has been hit heavily by this infection and their intensive care units are functioning well beyond capacity. They're just about coping. The rest of the country, outside a couple of very small clusters, know this is coming, know it's going to be big, but we don't know just how big. So most hospitals have doubled or tripled their intensive care unit capacity. Of course, we're not using the most expert staff to look after these patients any longer. That ship has long since sailed. And of course, we hear now that the military and the government are working together to look at entities like the ExCeL in London, the NEC in Birmingham and Manchester Central to house large volumes of patients. So we are trying to prepare to the best of our ability. The limiting step is going to be not only ventilators, but also skilled staff.
As you mentioned there, this is something that's unprecedented. We've never seen this before, certainly in our lifetime. So what can we learn from what's going on now? I know we're in a critical stage, but what can we learn from this pandemic?
So I think there are several things we can learn. Obviously, no society in, if you like, peacetime or a calm time where we don't have a pandemic threat is going to support their taxes, going to support a healthcare system that can double its capacity at whim. That would be wasteful. But what we need to understand, what we need to learn from this is resilience, vulnerability, and our ability to scale. We've gone a long way down the road in healthcare of increasing specialization. And what we're learning now with the skills deficit in critical care is that that's resulted in less transferable skills among the rest of the workforce. So our colleagues in medical wards, even in surgical wards, are becoming accustomed to looking after patients, receiving drugs to support the circulation, receiving high flow oxygen. They're not accustomed to that. And we need to get used to our healthcare system and being more resilient. But I think the other thing which we touched on earlier was around partnerships with industry. The planning for this demands on those partnerships being successful. And it's companies that are, such as Dyson, that are able to change their manufacturing processes to build what's needed right now. That's going to be critical.
Is that something that you see happening, Ron? I mean, because in the industry that we're in, there's reluctance somewhere along the line between the private sector, the public sector working together. It's something that needs to happen, but there is a reluctance there.
There is a reluctance, and there's a social reluctance for the sacred NHS to be influenced by the commercial sector, and we might need to redress that. There's a reluctance among health professionals, for quite right reluctance, for pharmaceutical industry and even for medical equipment industry to influence the sector. And I think these partnerships that are now burgeoning and developing and flourishing, and that are going to help to save our NHS, might unpick some of that anxiety and might help us to move forward more collaboratively in the future.
In terms of that then, do you see any positives coming out of what's happening at the moment?
So I think before we can start to look to the positives, and I think there will be many, we have to recognise this is going to be enormously painful for many individuals, for many companies, for many areas of our communities. So that said, I think this is going to have enormous benefits in the long term. We've become a consumerist society. We've become a society that has huge expectations of healthcare provision, even in the later years of life. We have a society that takes the NHS for granted, a society that perhaps has the wrong priorities in life, and companies that have focused on profit, which of course is important and of course is needed, rather than their corporate social responsibility. What my hope is, and many others that I've spoken to share this, is that those priorities will be rebalanced, realigned, and will move forward together as a better society in the long run.
Finally then, before we let you go, I suppose the message to everybody is heed the government advice and we will get through this.
Absolutely. We can get through this if society doesn't heed government advice. So right now, we're in a period of social distancing. We're in a period of lockdown and people self-isolating at home. And that's critical to slow the spread of this virus. We can't stop this virus easily, but what we can do is to slow its spread. And if we slow its spread, our NHS will just about cope. Of course, there's going to be an economic impact of this, but we'll get through that together.